Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Oscar Allen, Chief of Services and Programs at NACCHO. Thank you for joining us, Oscar.
Thank you. Such a pleasure to be here with you.
Today's session is about helping local health departments prepare for threats. They have lots of roles during an emergency. Among them are figuring out what the problem is of the threat, and then finding resources and ways to fix the solution, and then also collaborating and communicating about the problem. Local health departments contribute tremendously through their surveillance data. It's quite clear that a natural disaster, what the threat is, but there may be variation in how it's impacted the community. And also, when there's an infectious disease, surveillance is very, very important for figuring out what's going on. Tell me, in the local health department, how does that data get collected and used, and how is it used?
Sure. Thank you for that question. You know, the interesting thing, I spent 16 years as Director of Epidemiology for a local health department in New York, and data is what drives us. Oftentimes, it's the collection of information to be able to accelerate and move into action in a way that really supports the response level. So the surveillance data has come from several areas. You can have data from the clinical practices, the healthcare system, the public themselves, media, all types of streams of information have been very helpful, as well as from CDC and our federal and state partners, to really provide us with what we call situational awareness. And having that information allows you not only to see what's going on, but figure out what next to do and how you put those plans into action. Identifying what are community resources that are going to be important to really respond to the emergency or the disaster, and really ensure that we're all on the same page and ultimately communicate what we're seeing, what we're learning, and how we plan on moving forward collectively.
So so this data is used to kind of identify the problem, and then the next step is really responding and gathering resources. How is that part done?
So the implementation, right, taking that data, putting it into action, looking at resources. Oftentimes, health departments focus on what are those key partners and those stakeholders that exist. Is there a local coalition that you've obviously have been developing, not at the emergency, but before this point in time, drill and exercise. And now you know that there's something happening. Everyone has to play a role and a part. So galvanizing those resources, communicating with those partners, reaching out to communities with public health messaging, both from the inside and the outside world, to ensure that there is at least an global understanding as to what's important for us to move forward. And that you find that health departments really rely as that central force of the resource generator. Here, this is what we understand. Here's what we see from our federal partners like the CDC and others. And here's what this means to us at the local level, and what we can do to hopefully really enact change.
And so it sounds like collaborations are very, very important, and it's wide. It's not just local, state, and federal.
Correct.
It's also environmental health, public health, other first responders. How is that all brought together so that you can serve your population?
Sure. It's kind of why we oftentimes talk about public health as the community health strategists, especially local health departments. So you have to have the ability to speak to businesses, to other governmental agencies, private industry, as well as all of the other factors that come into play. It could be EMS, fire, the school nurses. Getting all those folks messaged in a way and as being part of what we call team public health is one of the vital characteristics that health departments serve, and how they're really successful at getting the message out and merely ensuring that everyone is part of this particular team response. And recognizing that it's not always going to be easy. How you say something to, let's say, a law enforcement community will be different than what you would do for a nursing home. And likewise, how do you address messages for the private industry and the likelihood of looking at a community disaster related or response. But all of that come to bear, I would say, that central convening ability for health departments to really be resource generation gathering information, both from our federal partners as well as disseminating information out. They have really become what we term as a local trusted entity that allows the public and others to really rely upon for any kind of emergencies or disasters.
And there's a role for the federal part too, and they also, what do they do with that, with building the coalitions?
So the federal department, especially CDC, has developed several programs and provide guidance and support for health departments, both at the state and local level, to be able to focus on what are those core competencies that, or capabilities is probably the better word, that need to be in place to really ensure that you are vibrant, you're resilient, and you're able to be resourceful in those types of scenarios. So the federal agencies not only help by providing those guidance, but also a lot of the coordination effort, getting out messages that can be tailored and provided at the local level, the guidance, as I mentioned before, in addition to the financial other support to ensure things such as medical countermeasures, for example, are able to reach communities, addressing other needs that may necessarily not come from, I'd say, provided from the federal landscape and disseminated down through the state and local partnerships. That has really been of significant impact, I would say, and part of the solution that the federal agencies have provided.
Sure, sure. And then the other thing that you had mentioned, but I wanted to touch back on it again, is communication, because I think communicating is, I mean, it's just key to everything. It's not only you trying to get messages out about being to the public about being safe, but also sometimes you need one resource but not another, and so that coordinating part. How is it best for local public health to prepare for an emergency?
One of the difficulties with responding to an emergency, as much as you try to preload what your message would look like, how you have developed templates for a particular disease or an outbreak, things are so fluid. As we saw with, for example, Zika and Ebola or H1N1, that there's a constant need to be flexible and resilient to new data. And oftentimes people don't like when things are changed. You know, you tell us this is the target audience that you need to focus on. These are the populations at risk. If you change it, then does this show that there's confidence in the information? So what the local, states, and federals do in that regard is try to ensure that they have as much updated information as possible to be able to communicate that in a moment's need with regularity and with confidence, so that the communities themselves don't necessarily feel that you are not communicating effectively, but you're doing the best as possible to ensure that you're acting upon the best information in your possession. And needless to say, it has its difficulties. One thing you could always say from any of the outbreaks or any of the disasters or emergencies you have to respond to, the after-action reviews, or we call them after-action reports, always talk to, well, how better can we communicate? What communication chain broke down, or how can we strengthen this? What new technologies can we use? Years ago, we weren't looking at social media for getting messages out. Now we're able to leverage those types of resources in a way that I think has been really helpful in the long run.
So it comes back to the data. It does.
As an epidemiologist, yes, it always comes back to the data.
If somebody was interested in finding out some more, where would you tell them to look?
Sure. Well, our federal partners, the CDC, have a wonderful website, emergency.cdc.gov, where you find a plethora of information, both for the private citizen, the local health professional, the clinical practitioner, and any local emergency preparedness responders. There's so much information that's available. I would definitely point them to looking at that. We have additional resources through things such as the Preparedness Summit, which is a meeting every year sponsored by CDC, which tries to bring all these public health preparedness professionals together every year to try to discuss what are new best practices, what are ideas that work, and how we can do things better, and what are new emerging issues that we can contend with. So those are some of the resources I would say you would find a lot of good and wholesome information on.
And there's also a lot at the NACCHO website too.
Well, certainly.
Okay.
At NACCHO, we have a preparedness toolkit. We have a bunch of best practices. We have a preparedness blog where we share tons of information, both for local health departments as well as anyone engaged in that space.
Okay. Well, thank you so much for joining us. Thank you. And thank you for joining us for Beyond the Data. See you next month.